Hey, it's Dr. Guy the Face Guy. Got a question about celebrities and maybe some bad work or why some celebrities look alien-like or different. And I think it's a great question, and it's something that gets brought up, not necessarily celebrities, but patients will come in and ask about surgery or about filler, about different treatments, and everybody wants to look good or wants to look normal. And just kind of this is an interesting subject to talk about why maybe some people don't look good after a treatment. And there's been discussions. Is it a problem with maybe body dysmorphia on the patient side, saying, "Hey, I want this. I think I need this," and pull me as tight as you can, or fill me up with as much as you can, or is it a issue on the surgeon side where they think, hey, more is going to be better. Let's pull as tight as we can, etc. Um, and going to the celebrities, you would think they would have access to some of the best surgeons, best opinions. But I think what it sometimes comes down to could be that some patients may say, I would never have surgery because I've seen those people, or I would never have filler because I've seen those people. And my response is usually, well, you've seen the good stuff too, you just don't notice it. So looking natural, I think, is always going to be the best bet. But to get a little bit more dialed in, I think some of these slippery slopes, some of these really odd looking results, uh, surgical or not, I see a lot of overfilling. I think with fat grafting can be great, but it does run a risk. If you're taking fat from one area of the body and putting it in the face, the predictability of how much is going to take um, is always a bit of a crapshoot. So that if you have a 100% take, then if you overfilled thinking you were going to lose some, well, now you have an overfilled face, and that's going to look odd. That's going to look strange. Um, I think sometimes people try to put too much into the cheeks, overinflate the cheeks, and give cheeks that people never had, even when they were younger. Um, um, I don't see so much the overpulled uh, fish mouth that I think was going on years ago. I think more people are doing extended deep plane lift, getting more natural results. But the eye does go towards things that don't look normal, don't look natural. If you are thinking about having surgery, I think you need to look at a surgeon's before and after results, see if that's something you like, their kind of style, if you want to call it that. Look at their results. I lean more towards a natural result, trying to restore maybe what was lost or what has changed with age, and just try to be the best version or the best look that they can get. Um, you look at like Denise Richards just had an excellent lift. You looked at her results; she looks very natural. But then you look at some people like Madonna, overfilled, looks a little odd, looks strange, and um, I think she has too much filler or too much fat grafting done, things that were just taken to the extreme. I think there are definitely some trends that kind of happen within cosmetic industry, aesthetics. Um, I just always would caution patients who are wanting maybe something that's trendy that would be drastic, that is not going to age well or not reversible. So I think it's just having that relationship with your surgeon, being clear of what you're looking for. Um, know that whenever we do a lift, lots of times it looks a little pulled in the beginning just because of the swelling, and then it does soften up. Um, uh, and there are some restrictions of results just basically off of the patient themselves, their health, their tissue. Some people have better tissue to work with, and when you have that kind of patient, it's great because you just know, like, hey, these are going to be great results. And then there's other patients that have maybe thinner tissue, don't have that elasticity, and it's a little bit more difficult and a little bit more tedious as far as getting those results you're looking for. So when it does come time, just make sure you have a good relationship with your surgeon. Take a look at their before and afters. But I always tell people, you don't notice the good stuff, and that's what makes it good.